We're going to talk today about our liquid facelift procedure. And while it isn't truly necessarily a facelift from a surgical aspect, we're giving people a more youthful, a more lifted appearance with the use of fillers, Botox, and non-surgical treatments. So these are the assortment of products that we use, and Botox, we use that to relax the lines or wrinkles, the frown lines, the crow's feet, the forehead lines, and help to balance those areas. Filler products are what we use to replace the volume that we lose, because we lose bone, we lose muscle, we lose fat where we want it, we start to gain it where we don't want it. So if we look at these pictures here, we can see that this youthful person has this nice rounded cheek. They call this an OG curve, which is an outward and inward curve. Some people call that the apple of the cheek there. And as we mature, we lose elasticity of the skin, we lose volume, and this cheek starts to flatten. And if we look at a little further out, it's really flattened completely and sunken down in those areas. So by replacing volume, we can help. One of my best examples is this young lady here. And when she came to us initially, she wanted to treat down in this area. So we placed some fillers here, 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 and a little bit in the lips. On a separate visit, she wanted to do some Botox here, and we filled up in these areas. She left for vacation, and when she came back on this day, it's interesting because I thought I walking in thinking she'd be very happy, and she said that she really didn't see any difference. Now it was easy. You put up a picture like this, and it's a wow, it's pretty dramatic, but you can see how she's flattened and sunk in these areas. She's very straight from the cheek to the jawline, and a youthful balance is thinner here in the temple, fuller here, narrow at the jawline. So just with the fillers and Botox, we were able to give her this type of balance. Okay. She came back to us a year and a half later, and the first thing she said was, "It's all gone." And I said, well, let's pull out the pictures. So this was the original 2 months out, a year and a half out, and we can see that she's still not back to where she started. She's not quite as good as she was here right afterwards, because depending on the products, they last a long time, but we continue to age and mature. We haven't started that process. We haven't stopped that process. And we do need to replace some of the volume with the fillers over time. All right, the other thing we'd like to talk about is how much filler we need. And this is very individual, really can best be determined at a consultation where we hear what your concerns are, and then we match up the treatments, the products, the procedure to get you the best result. Here we're looking at 4 different patients, everyone before, and some patients, their lines or wrinkles are deeper, and some not as deep. This is everyone with 1. And with 1 syringe, someone that's not as deep, we can do more. But someone that's deeper, 1 didn't do that much. And it's not that it didn't work, it's that they needed 2 or they needed 3. And this young lady here, it's really in the 7 category because we have here, 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 the chin, the lips, and then we came back and filled this and did a little fine tuning in those areas. So that's what can be done with these types of procedures, keeping people looking very normal, very natural, doing it without a full-on surgical procedure, and giving them a nice natural result. So this is our AccuVein, which is actually a laser, but it's a laser that's going to show us blood vessels underneath the skin. It can show us up to 11 millimeters deep into the skin. And so we're going to go ahead and turn on the AccuVein, and so we'll see that light, if we look at my hand, we can see that it can show the blood vessels here. Or with this young lady here, if we were going to treat this young lady, we could actually mark the skin in these areas to avoid those dark lines, which are the blood vessels in those areas. So this is going to help us give a nice treatment and reduce the risk of the bruise. We can see down around that marionette how we could stay just inside of there to give her a nice result and still be able to reduce the risk of a bruise here. Right out in these areas, we do have some blood vessels there, so we have to work around those. Working with a magic needle would be excellent. So the magic needle would allow us to treat this area while avoiding those blood vessels and doing that very safely. This is a technology that they used for starting IVs in the hospital, but something that we can use here in the office for our Botox treatments, for our filler treatments, to help reduce that risk of a bruise. So we're very excited to offer this technology here at Nowak Aesthetics.